what we say, of course, is that it's taken a couple of generations to get to the point where we have this epidemic of childhood obesity and people not being physically active. And as you say, you can't turn that around overnight, which is why we agreed it should be called a movement rather than a program. I've a firm believer in leadership by example. And everyone knows that the mayor is well, most people know. If those who don't know, that you jog, you ride your bicycle. How did you develop your own personal philosophy of wellness, and how do you see that interacting with who you are and what you do?
Well, in the early 80s, I began to jog, and it was one of the things that I wanted to have dessert once in a while, and the only way I could figure out how to do that was to literally create an exercise routine that would give me the chance to be able to eat and not gain weight. And so I was running 30, 35 miles a week, and I'd go running 5s and 6s, and ramped up and ran 16 mini marathons and ran the New York Marathon in 1983. And it gave me a chance, as I say, to sort of keep my weight off and also exercise and feel good about myself, which is really an important, there's a personal pride that one gets when you set a goal and you reach that goal. I mean, I can remember finishing the New York Marathon, and I had tears in my eyes because I had trained for so long to run 26.2 miles, and here it was, and I accomplished my goal.
An amazing feat.
Yeah, and so those are the kinds of things that anybody can do. Just set yourself a goal and go after it, and be committed. So running has always been my thing. Now, most of the baby boomers, their knees and their hips and their ankles are going, especially the ones that were athletes.
Yeah.
If you were an athlete, when you were in your teens, the odds are your hips and knees are gone. So you're looking for some way to exercise. Luckily, I played in the band, and so therefore I didn't have any athletic experiences, so my knees are fine. So I'm still running, but I'm not running 30 miles a week. I'm running 15 miles a week. But then I began to see the boomers move to bicycles. And, generally speaking, as you go through the chronology of where the boomers are is where the action is, simply because there's so many of them, or of us. Yeah. And so as a result, I began to focus on the communities that really engage in bicycling, building the infrastructure, supporting the efforts, will keep the joggers and those who have been out for years working on their ankles and their knees and their hips. It'll keep them exercising if they have a safe way to do it, if they have the infrastructure to support it. And that's when we joined with the bicycle club here and set up the summit for a day and a half. And out of that came all that you see and so much more to come.
Can you tell us quickly about worksite wellness? I know that we've talked about how to get people in the workplace involved in wellness and how to get more workplaces to create programs.
Well, a lot of the insurance companies are really, health insurance companies are pushing. We have these pedometers as a result of our insurer who's saying to us, it's time for people to get out and walk, take the steps, don't take the elevator, walk and prevent getting sick. In other words, ensure wellness and good health. And so what you find, and what I've been dealing with the CEOs and business leaders of the community, is to say to them, you'll have a much more productive workforce if they're exercising and they've got good health and they're feeling good about themselves. And so you, employer, need to engage and provide the kind of support to ensure that your workforce really does stay as healthy as possible. And more of them are realizing it. And then all of a sudden, when their employees aren't getting sick, over a given period of time, the analysis done by the health insurance company says that their rates go down because they have a healthier workforce.
And I know that we've partnered with GLI. Do you want to speak briefly about the awards ceremony?
We've taken it to a level where GLI, which is the Chamber of Commerce, literally at their annual business meeting, selects a company over 5,000 employees, over 1,000 employees, and then one over 10 employees, where the company receives an award because of their willingness to engage their employees in eating right and healthy exercise.
We only have a few seconds left in this part, but I want you to speak briefly on your perception of how other cities are doing, how we're stacking up against other cities of comparable size.
Well, there's some cities that have been out there a little bit ahead of us, but when you look at our competitors, the Cincinnati's, Indianapolis's, Nashville's, Columbus, Birmingham's, Richmond's, we're at the head of the pack with that crowd and feeling really good about our future.
Very good. Thank you for the opportunity so far. We have more to come. We'll be taking a pause and we'll be right back.